Hi, my name is Kristen and my business is Well Balanced. I want to talk today about back pain. And I could write probably a book on how many people come to me with back pain. And so often we think like, gosh, I pulled it, or I'm just out of shape, or I slept wrong, or whatever the stories we tell ourselves. But more often than not, I'm always finding there's an emotional component. The back is really highly sensitive to holding our tension, right? And it's the same with our shoulders and a lot of people, their hips. But in particular, I get a lot of cases on back pain. And so this one woman came to me and she said, my back has been killing. I haven't been able to walk really for a couple days now. I said, okay, well, tell me what you did. What happened to cause the back pain? And she said, well, I was just making my bed. I just was reaching over and fluffing the pillows. And she goes, it's that feeling I get that just goes shh, and it ripped through. She felt like it went right through her back. I said, okay. And I said, do you have a history of back pain? She goes, well, yeah, like about 4 years ago, I had surgery on my back, L4, L5, because my discs were compressed and I was in so much pain. I said, okay. And then any other times? And she said, yeah, there was another time that my back went out and another time that my back went out. And then today. So this is the 4th time my back went out besides my surgery. And I said, okay, all right. I go, it doesn't sound like you did anything really that hurt you just recently to cause back pain, right? I said, so let's kind of unpack this a little more. What was happening in your life when you had your surgery? She said, oh. She said, that's my life was a mess then. I was just going through so much trauma and stress and helping people in my life that are sick. It was a lot of trauma. I said, oh, okay. And then you had surgery. She goes, yeah, my back was killing. I'm like, okay. I go, tell me the next time that your back went out. She goes, well, my husband died. I said, oh, okay. So that's when your back went out, was your husband died. She goes, yeah, I was really sad. And I said, I can understand. I said, the 3rd time, what happened? She goes, well, my mom died. I said, okay, all right, I can understand. That's so sad too, but that caused your back pain, possibly. And she goes, yeah, I didn't even put these all together. And I said, and tell me what just happened a few days ago. She goes, well, she's a caregiver. And she said, I thought my person I was taking care of was going to pass away. She was having a really difficult couple days. And I said, I said, are you starting to connect the dots between all your back pain? She goes, yes. She goes, I never thought of that. And I said, no, most of us don't. We just think back pain, muscular, must have did something to hurt it. I go, I feel like it's becoming my main job or my main passion in life is to educate people on how our fascial tissue, which is nerve connective tissue, right? It runs through our entire body and it locks up and it protects. It's like a human Band-Aid. When it feels stressed, or if it is physically hurt, or if there's emotional stress, it tightens. Any kind of contractions in our muscle, like we're stressed, so our muscles are contracting and the fascia locks around it. I said, I feel like, if we could all just learn to realize when we are going through times of pain, back pain, knee pain, hip pain, shoulder pain, first, before you go jump to the doctor, take a look at your life situation. What is going on in your life? What emotional components are going on? So often they go hand in hand. So what I did with her is all right, so we see there's an emotional component with your back pain. And I said, so let's set the intention. I always have clients set the intention in their heart for what they want healing. And so it is a very conscious, very intuitive healing that I do, because I want the person to put in as much of their intentions into the healing as I do mine and the physical things that I can do to help people release the tension. So I had her do that. I had her lay down on the bed and on my table. And I just started having her breathe. So a lot of times when we're in a tense place and we're in pain, we hold our breath and we're not relaxed and we're not allowing our body to relax into the moment. So that's part of that tension, right? So a lot of times I have people put their hand on their heart, start connecting to your heart. Breathe in, feel your heart expand. Breathe out, feel your heart contract. So start connecting to our heart. Come back to you. Come back to the basics. Come back to your breath. So I have people start with that. They close their eyes. I close mine because I'm super intuitive and I need to feel what's going on. So I close my eyes too. And we start breathing through all the stretches. I'm a fascial stretch therapist, if you haven't followed me, and a Reiki practitioner. So as I'm stretching the tissue to hopefully help alleviate the back pain, right? I'm also helping to dial down their nervous system. And so the two go together so profoundly. It is, you can't even almost separate the two. If someone were to come to me and be resistant to relaxing and letting go, they probably walk out my office with the back pain still. So the fascia and the body needs to relax in order for the muscles to go from a contracted state to a relaxed state, in order for the fascia to go from grabbing on to relaxing and becoming that gel-like substance it's supposed to be, not paper stuck to our muscles. So I'll continue with her story. So I'm stretching her. I'm also an intuitive healer. And as I'm stretching her, I'm seeing these waves of sadness come out, and I'm seeing that she hasn't properly processed the death of her husband and the death of her mother. And she went right into caregiving for other people as a way to cope, which is beautiful, to give back, right? But if we don't do our healing, our body is going to keep the score. And our body does keep the score. So she had to learn to relax into giving herself that 1 hour just to relax into the stretches in order to release the emotion. So I start to read all this. It's like I can just see what's going on in someone's life, and it's not for my benefit, right? It's for their benefit. It's to say, oh, hey, look at what is going on in your life. Hey, look at what is stuck in your tissue. Look at your whole life. Give yourself compassion. Give yourself grace. Give yourself a chance to heal. So by the time we're done, and tears and everything, which is super therapeutic, and some other deep issues came out of just where she is at in life, she said, oh my gosh, I feel like a different person. And I said, yes. I said, so here's the thing. Healing is not one and done. I mean, we didn't just go unpack your whole body right here and now you can just go on. Really, healing takes time. We probably just took a few layers off of your stress and your back pain. Her back pain was gone, by the way. So I said I would like to do some Reiki as well, which is a healing touch, is healing through God's knowledge, God's energy. And so we got her all quiet. We did Reiki, and it was beautiful. It was just a beautiful, beautiful, relaxing, meditative time for her. Very restorative. I feel the energy go in. I feel her body coming down more and more from the fight or flight that she had been in. So by the time we were done, it always makes me smile, because people just are like, what just happened? Where am I? Reiki is, we're healing with the divine energy, with God's energy. It is beyond words. So usually it takes them a while to come to. So she sat on the couch, and I said, it might be a good time to journal. I think you're feeling very open and very receptive to healing. I said, so take some time. I'm going to go ahead and go. Take some time and journal about your journey. Your journey has been very traumatic for the past 4 years, and you haven't really given yourself time to process. And so just do it if you want to. And she goes, yes, I want to. And I said, okay. So usually, again, people work with me for several times. It's kind of like therapeutic, passive therapy. So she got 5 sessions, and that's a really good therapeutic amount. I came back the next time, and she's like, oh my gosh, my back hasn't hurt since. She says, but I am very aware of how I hold my tension and my stress. And I realize that if I'm busy, then I don't take the time to really think about me, and I shove all my emotions down, and I just stay busy. And she said, so it really has opened my eyes to processing my emotions, feeling them, acknowledging them, honoring them, but also letting them pass through. And our next couple sessions I've worked with her have been absolutely beautiful. And she is like this flower, opening up a little more each time. And so where I try to get people to is a place where all that stuck energy has been released from the body, and you feel clear. and you feel whole. And so once you feel clear and you feel whole, you'll be very, very receptive to when you start to pack in that negative energy again in your body. You'll know, you'll go, oh, my back started to hurt. What am I doing? Am I starting to hold on to something? And you'll have these moments where you can just stop yourself, honor it. Like if it's a back pain, honor it. Do some, do some deep breathing, do some techniques. I have a lot of techniques. I'll share with them on other videos on how to stay centered, how to stay relaxed, how to ground yourself, how to release anxiety, things like that, breath work. All these things are tools. And one final thing, we can heal and we can learn to cope in ways that maybe we've never done before, but we have to use the tools. It's not like it magically comes. Again, we're kind of at this place in society where we want that quick pill, but it is so cool when we can be the one in control of our own lives and say, okay, I'm gonna slow down, relax, connect to my God, allow my emotions to come and go as they want, but I'm not gonna ride them like a tornado anymore. I'm going to step back and just watch emotions come and go because that's part of life. So if you like what I say, I have lots of videos. Take a peek at all the different videos and testimonies of beautiful stories of healing and beautiful stories of transformation, all through learning how to let go and receive the healing. Have a great day. Thank you so much.